Good day, everyone. I'm Dr. Adejare. Today, I want to talk about self-medication. Self-medication. Some people think self-medication is nothing. Self-medication is a small thing. Self-medication doesn't affect. Self-medication doesn't mean anything. It means a lot. It means a lot. Don't joke with your head. Don't even try to joke with it. But before then, I'd like to tell you, try and subscribe to our YouTube channel at Adejare. Subscribe, like and comment, and refer your friend and family to our YouTube channel to watch video, like and comment. There are educative program in our videos. Thanks so much. At Adejare, you write it together, no space. So then, self-medication. Self-medication. Do you know there are some medicine that you use or drugs that you use that damage your organs? If you don't know that, now you know. That is why self-medication is dangerous. Don't do self-medication, and don't go to chemist that you have this, you have that. Just carbon for me, it's dangerous. It's very dangerous. Self-medication is dangerous in the extent that using a drug without doctor prescription, it's very dangerous, because there are some drugs that you don't know that it's not good for your health. You won't know you'll be using it, and you won't know until it damage your kidney or liver, and you are trying to skip. You are trying to manage money. Later, you go and spend what you don't want to spend. You spend more you don't want to spend, which is very dangerous for your health. Don't do self-medication. I always said it to you, my people. If you have any complaint, any symptoms, your symptoms might be malaria within you, but as a practitioner, it may be more than malaria. We know that this what is happening to you is not malaria, it's something else. You cannot know. It's that you know. Sometimes you think you have malaria, whereas it's another thing, it's not malaria. You not be using anti-malaria. Use it every week. You sick every week. You go and complain to Kakbo, they will give you Kakbo 200 naira, 500 naira, 1,000 naira. That don't help you. Getting a medicine yourself is the same thing going to a chemist and getting a medicine that you are doing self-medication as well. That is self-medication means you are not well diagnosed before taking the medication. That is self-medication. If you go to Kabo, you don't have option. They will give you a medicine. They are there to collect your money. But we as a practitioner, we are not there for that. Firstly, you go to, when you come to us, we refer you to a laboratory test. You do tests. Don't run for hospital. Hospital don't kill. Hospital, we are your friend. We take care of you. We care for you. We diagnose you very well under professional treatment. We refer you for laboratory tests. After the laboratory test, we discover what really happened. Then we give you a comprehensive treatment. Some say, doctor, I used to have typhoid. The typhoid did not go. I treated it a lot of time. Still yet, the typhoid still in me. What is happening? Do you know why? You are doing self-medication. If you are well treated, firstly, you have to go to a facility that they are very, very competent. When you go there, they will give you they will diagnose a test for you. If you are well diagnosed, they will know how much is the typhoid in you. They will use that to treat you. They don't treat you with brain. They use that experience to treat you, due to your results. They use that to treat you. They use that to treat you. You are well diagnosed. When you go to test, when you go for the test will tell us how much is your typhoid, how many it is. If you need medicine, you will be given. If you need injection, you diagnose that. If you need drips and injection and tablets, we do that. That is purely medical. So I will advise you, after, even if your doctor don't mention it, after you treat such typhoid, go for the test again, repeat the test, just leave like 5 or 7 days, go for the test again, and do the test again. The test will tell you maybe you are free or you are still with the typhoid. Then you know what is going on. That is purely treatment, not just going to a laboratory, to a chemist or to a qualified hospital. They will just be giving you injection or drug. Those drug damage if it is much. So don't do self-medication. Self-medication is when you go to an incompetent place to complain. Self-medication is when you go to a chemist or anywhere, ekabo. That is self-medication as well. Please don't do that. Go to a well and standard hospital. They will diagnose you. They will refer you for a test. When you are tested, they will tell you what the test tell them, and you will be well treated. And the story of that, what happened to you, it will go. Don't just say malaria. Sometimes malaria don't happen to you. If you even do malaria test, it will tell you negative. But you have been using drugs for malaria every week, but it's not malaria. It's something else. It might not even be malaria. It might be kidney or liver problem. It might be intestinal problem. It might be ulcer. It might be anything. But you diagnose malaria very easy. Any small thing is malaria. Especially these African people. Any small thing, malaria. Headache, malaria. You can't eat well. Your taste change, malaria. You have headache, malaria. No, some other thing happen more than malaria. That is why some disease or some sickness kill in Africa, because you don't do well diagnose. Because when you have any complaint, you think it's malaria, you go for malaria test. You don't even go for malaria, you just go for malaria medicine. And when you go for malaria medicine, you be treating what is not. And that medicine we are using is because that malaria is not in you. That medicine that you are using, it will affect other things in your body. That is why some treatment don't go. So please, my people, I urge you not to treat yourself by yourself. Go to hospital, complain to a doctor, let them diagnose you well, and you'll be okay. Self-medication kills than gun. Self-medication kills than HIV. Please be well diagnosed so that you be well treated. Don't do self-medication. It's not good. It's not good. Don't try it at all. It's very, very dangerous. And as well, don't abuse drug. That is drug abuse. Don't abuse drug. Drug abuse. Don't abuse drug. Don't abuse drug. If you abuse drug, it's another thing entirely. Some people don't do medicine. Some people don't do self-medication. They will go to hospital. They will come to us. We diagnose for them. But because the medicine, they know that their body system is very strong. Use one in the morning, one at night. You will not be using 2 in the morning, 2 in the afternoon, 2 at night. You may not feel anything, right? But the drug will react. The drug will damage something in you, because as a professional, that we said you should use 1 in the morning, 1 at night. We know how the medicine works. You know how it reacts. But you now decided to take, instead of taking 1, you now decided to take 2, 2. You abuse the drug. That is drug abuse. Drug abuse. And There are some people that they don't even go to hospital, they just go to chemist and get some medicine and they abuse it. It's very dangerous. Not for me, for yourself. For yourself. There are some people, they will go to lab, they will go to chemist, they will go and buy cough syrup. Instead of using 2 spoons, they will use the whole bottle at once because they want to hide. All the name of hide. If you hide, what will happen? Will the world change? What still remain? But you go because you damage your kidney. And when you damage your kidney, do you know how expensive kidney treatments? Do you know how expensive kidney transplant is? Do you know how it's difficult to get a donor? So please, my dear people, don't kill yourself before your time. Don't kill yourself. Don't do self-medication. Don't abuse drugs. Those drugs are not as you guys are using it. You're supposed to use sleeping tablets once or 2 daily. If you're using 6 or 10 at a time because you want to hide, then if you hide, will you be a billionaire? If you hide, will you be in another life? If you hide, will the world change? You are killing yourself small. Please don't kill yourself. Don't do self-medication. Don't abuse drug. Don't do self-medication. Do you get me? Don't do. What I'm trying to say is, don't abuse drugs. Some don't even come to us before they abuse drugs. They just go and get it themselves because they are paying for it. Though it's your money, it's not mine. But imagine using your money, your hard-earned money, to kill yourself small. Just imagine. I saw something online some months ago. A group of guys, they took cough syrup, many, into a cup. They put yogurt on top. They put those other drugs I don't want to mention. They put it inside and they drank it. After then, they are misbehaving. I don't know the end of their life because I don't know the end of the story. Just imagine. The cough syrup that's supposed to use for like 7 days, they put like that 4 or 10 bottles into a cup for like 2 or 3 guys taking it at the same time. It's very dangerous. Please don't turn this world to another thing, because I don't want any of my people to have any issue. That is my advice for you. Please, self-medication is dangerous. Because when the problems come, it won't be only you again. It should be your society, your family, your society, even us as a professional. Because when you come to hospital, you want results quickly. You want quickly treatment. And we might be busy or we have been studying something. You won't make us rest. You'll be shouting, "Doctor, do something. Doctor, you are not doing something. Doctor, you are this. Doctor, you are that." Whereas we are watching you. So please, and please, don't do self-medication and don't abuse drugs. If you are buying drugs, don't just buy it and use it. Ask where you get the drugs. Sorry ma, sorry sir, how will I use it? And follow their instruction. Follow their instruction. I don't say you should not buy drugs in pharmacy or chemist. Buy it there, but buy a recommended one. Buy a recommended one and don't abuse it. Doctor telling you to use one in the morning and at night. You are not using two. It's dangerous. It's very dangerous. Just for your head, not for me. You are not spending for my purse, for your own pocket. I'm not the one having the problem alone. You yourself, you are having the big problem. My own problem is to take care of you. Yours is to be in pains and spend your money. Now you are not using your money to affecting yourself. You are using small money to spend big money, because those drugs that you are using, as me you get those drugs 5k, You bought them 5,000 naira, and when you have problem, I want to manage you might spend 500,000. It might damage some things in your body. So please and please, don't do self-medication and don't abuse drug just for your own good. Don't abuse drug, please. Don't abuse drugs. Don't tell. Some people say, doctor, we use that thing to reason what? Assume you have problem now and you want to reason, you reason. After the problem, your reason, after what you drink, after those things that you have meant, you have concoction together and you take, when that thing went away, when that thing go away, don't you know that your thinking that you are reasoning, it will still come back again? So please and please, don't do drug abuse. It's very dangerous. And taking drug abuse, all things that we have got for a long time, you can spoil it within few seconds because you don't know what you are doing again. You can even kill yourself, you can kill someone, and when you got arrested, everything that you are thinking, you still add to your problem. So please, when you have problem, solve it within yourself, solve it amicably. Don't think of injuring yourself, don't think of drugging yourself. It's very dangerous for you and the society. So I hope you understand me very well. If you have any question, ask the question under comment section. Likes and comments. Refer and subscribe to our YouTube channel at Dr. Wale at Dr. Wale. Please subscribe to our YouTube channel. God bless as you do. I remain your host, Dr. Adejare. Till next time I come your way, have a blessed day. Don't forget, your good health is in your hands. Don't take that for granted. Have a nice day. Bye. Ẹ kú ojúmọ́ ẹ̀yin èèyàn mi gbogbo. Ẹ kú bí ọjọ́ ṣe rí. Èmi ni dókítà yín tó nífẹ̀ẹ́ yín tọkàntọkàn, dókítà Adejare Ayọ̀bámi. Ṣùgbọ́n kí n tó sọ tí mo fẹ́ sọ lónìí, ẹ má gbàgbé àti tẹ̀lé mi, àmì tẹ̀lé mi, ẹ tẹ̀lé wa kẹ́ ẹ lè máa mọ gbogbo ètò tí bá lọ lóòrèkóòrè lórí agbègbè wa gbogbo. Ẹ tẹ̀lé wa lórí at Dr. Wale Ayọ̀, lẹ́ẹ̀fì tẹ̀lé wa lórí YouTube. Kẹ́ ẹ sì nífẹ̀ẹ́ gbogbo fídíò wa. Kẹ́ ẹ nífẹ̀ẹ́ fídíò yìí náà, kẹ́ ẹ béèrè ìbéèrè, kẹ́ ẹ sọ̀rọ̀ nípa fídíò yìí bóyá ó dà bí ò dá, ẹ sọ̀rọ̀ nípa rẹ̀. Ẹ ṣé púpọ̀. Èyí yìí fẹ́ sọ fún yín nípa oògùn àdálò. Kí ẹ máa dóògùn lò láì lọ sọ́dọ̀ àwọn akọ́ṣẹ́mọṣẹ́. Kí ẹ máa lo oògùn láì gba àmọ̀ràn lọ́dọ̀ akọ́ṣẹ́mọṣẹ́, ewu tó wà níbẹ̀ kékeré kọ́. Ẹ jọ̀ọ́, ẹ má jẹ́ àdóògùn lò torí pé kíni ewu ẹ̀ pọ̀ gan. Ká má dóògùn lò. Ẹ jẹ́ ká lọ sí ọ̀dọ̀ àwọn akọ́ṣẹ́mọṣẹ́, ká lọ ṣàlàyé fún wọn bó ṣe ń ṣe wá. Ọ̀pọ̀lọpọ̀ ìgbà àròbá ní ibà ni a sì ní ibà. A máa lo oògùn ibà, a lò bákan náà ni. A lo oògùn ibà kò ní sí nǹkan. Ẹlòmíì máa lo oògùn ibà lọ́sọ̀ọ̀sẹ̀. Ibà ọkọ̀ ló ń ṣe lọ́pọ̀lọpọ̀ ìgbà. Ọ̀pọ̀lọpọ̀ ìgbà ó lè jẹ́ nǹkan míì, ó lè jẹ́ àìsàn ibà kójúpọ́n, ó lè jẹ́ àìsàn ibà jẹ̀fun-jẹ̀fun, ó lè jẹ́ àìsàn ibà jẹ̀dọ̀jẹ̀dọ̀, ó lè jẹ́ àìsàn míì lágbo ara wa ló ń ṣẹlẹ̀ sí yín. Ṣùgbọ́n ẹ̀rù ibà ló ń ṣe yín. Tí bá ti gbórí ti ń fọ́ yín, ibà ni. Ara yín gbóná, ibà ni. Inú run yín, ibà ni. Ẹ lè sùn, ibà ni. Àwọn yín yí padà sí kíkorò, ibà ni. Ǹjẹ́ jẹ́ máa ń pè gbogbo àìsàn tí mo dákọ sẹ́yìn bí àìsàn ẹ̀dọ̀, àìsàn kídìnrín, àìsàn líle ní oúnjẹ, àìsàn inú ìfun, àìsàn káàkiri àgbára pátá bákan náà ṣe máa ń ṣìyàn báyẹn náà. Ṣùgbọ́n ọ̀pọ̀lọpọ̀ èèyàn ẹ ti sọ di pé tí nǹkan bá ti ń ṣe yín pẹ́rẹ́, àìsàn ibà ló ń ṣe yín, ó lè má jẹ́ ibà ló ń ṣe yín. Ẹ lọ sí ọsibítù. Mi ṣe máa sọ fún yín, owó tẹ́ẹ̀nù ò ní pọ̀, owó péréte lẹ́nu. Àkọ́kọ́ náà, ọ̀pọ̀lọpọ̀ ilé ìwòsàn kò yẹ gbowó káàdì lọ́wọ́ yín. Kọ́tà gbowó káàdì lọ́wọ́ yín gan níwọ̀n bá ní bí 1,000 kan lówó káàdì. Tó bá gba káàdì 1,000 kan, ẹ rí akọ́ṣẹ́mọṣẹ́, wọ́n ó fún yín lánàá tó yẹ kẹ́ ẹ tọ̀, bóyá nídìí àyẹ̀wò ní o abẹ́ nídìí ògùn lásán abẹ́ nídìí abẹ́rẹ́ wọ́n ó ṣe fún yín. Ẹ má lọ ṣẹ́rẹ́ tó lọ sí ọ̀dọ̀ kápọ̀ tọ́ntọ́ ní 100 naira fún àbí jù bẹ́ẹ̀ lọ kò yàtọ̀ sí ẹni tí ó lọ lògùn fúnra rẹ̀. ẹ ń lọ ọ̀dọ̀ àwọn kápọ̀ wọn ò ṣàyẹ̀wò nítorí sọ fún wọn ní wọ́n gbàgbọ́ wọ́n sì fún wọn lóògùn tó bá yíwọ́ wọ́n láwọn ọmọ sí wọ́n wà sọ́sítù wọ́n mọ̀ wá ìwòsàn kíákíá tí ó dẹ̀ rí bẹ́ẹ̀ ní tó ti ń bàjẹ́ ní àti ọ̀pọ̀lọpọ̀ ọdún sẹ́yìn máa wo tó ti ń bàjẹ́ láti bí ọdún 3 ọdún 5 sẹ́yìn owó àjọ sọ́sítù ní èèní owó àtúnṣe lójú ẹsẹ̀ tí ò ṣeé ṣe. màá ròyìn máa bẹ́yìn ẹ má máa dá lóògùn láì lọ sọ́dọ̀ àwọn akọ́ṣẹ́mọṣẹ́. ọ̀pọ̀lọpọ̀ ìgbà yìí di àyẹ̀wò ọ̀pọ̀lọpọ̀ ìgbà ẹni di ìtọ́jú tó péye. ìgbà míì wọ́n tẹ́ pé ẹni di oògùn ẹni di abẹ́rẹ́ ìgbà míì rí ẹni di oògùn ẹni di abẹ́rẹ́ ẹni láti yí oúnjẹ tẹ́ ń jẹ padà ní. fún di èyí ẹ má máa dóògùn lò. ẹni tó lọ dọ̀ àwọn kápọ̀ tó bá fún lóògùn àti tó lògùn fúnra rẹ̀ tó dàlú fúnra rẹ̀ nǹkan kan àjọ ní ẹjọ́ ń ṣe àdálóògùn ni torí kí ni wọn ò ṣàyẹ̀wò fún ọ wọ́n kàn fún ọ lóògùn ni wọn ò sì kọ́ṣẹ́ mọṣẹ́. tó bá kọ́ṣẹ́ mọṣẹ́ wọn ò ní gbọ́n tó sọ nìkan láti tọ́jú rẹ̀ ní tó sọ wọn ó rò pé ní tó sọ yìí ó lè jù bẹ́ẹ̀ lọ ṣàyẹ̀wò lọ sí ọsibítù lọ báyìí ń bọ̀ yí mo rọ̀ yín ẹ má ṣe bẹ́ẹ̀ ẹ lọ sí ọ̀dọ̀ àwọn akọ́ṣẹ́mọṣẹ́ kẹ́ ẹ tó ṣe kíni kẹ́ ẹ tó máa lo oògùn tẹ́ ń wò yẹn ó ní àbùkù lára. oògùn tẹ́ ń wò yẹn ewu tó wà mẹ́ẹ̀ pọ̀ gidi tẹ́ bá ṣì lò torí ẹ̀ ni mo fi máa ń bẹ̀yìn mo máa ń rọ̀yìn ẹ má ṣì oògùn lò ẹ lo oògùn ní ọ̀nà tó péye kí Ọlọ́run kó ràn wá lọ́wọ́. lẹ́yìn náà mo fẹ́ sọ ń pa kí ẹ máa ìgbàdí oògùn kí ẹ máa lògùn ní ọ̀nà àìtọ́ ó yára pàyàn ju kí èèyàn yìn èèyàn gan lọ. ó yára pàyàn ju kí èèyàn ní àrùn kò gbóògùn lọ torí pé kí ni òkúta ní kó lo méjìlá lẹ́ tó lo méjìlá rọ̀ méjìlá lẹ́ ewu tó wà ń bẹ̀ ó pọ̀ gidi yóò mọ̀ bá àwọn èròjà nù rẹ̀ jẹ́ ni. ìwọ́n tó lọ mọ́gùn kọ́ tó yẹ kó lo sí méjì lẹ́ẹ̀kan náà kó lò ní ìṣẹ́jú mẹ́fà síra wọn wákàtí mẹ́fà síra wọn tó wá mú ìdí ìgò 4 6 ó wá dà papọ̀ ó gbọ́n nǹkan míì mọ́ ó wá mú tí ó lérò pé ara rẹ̀ ó lálàáfíà bó ṣe lóhùn ìwọ́n ló kó fi ń pọ̀ ọ̀nà rẹ̀ ní tó ń ronú yẹn tó bá ti mú kí níyàn rí ó onímọ̀ tó ń ṣe mọ́ ó lè pààyàn ó lè bá tí ó ti ṣe ní ọ̀pọ̀lọpọ̀ ọdún jẹ́ ìjọ́ torí Ọlọ́run ta ló padà ní ìṣòro ẹ jọ̀ọ́ ẹ má ṣe tí ìdá kó bára yín ó lè yàyàn wéèrè ó lè gbẹ̀mí èèyàn ó lè bá nǹkan jẹ́ lágọ̀ọ́ ara wa tó lè ṣe fún wa pọ̀ gidi mo fọlọ́run bẹ̀ yín ẹ má lo oògùn tó lè gba ara jẹ́ mọ́ torí bí kí ni kí àwùjọ wa lè dùn ó dùn rí ìwọ tó ń lo oògùn tó ń ṣe oògùn lò torí pé òun ìrònú rẹ yóò di nǹkan míì tó bá lọ ṣe ṣèdí lára rẹ nítorí fowó kójọ fún ọ̀pọ̀lọpọ̀ ọdún tó bá lórí oògùn bẹ́ẹ̀ o lè bàjẹ́ láàrin ìṣẹ́jú péréte tó bá pààyàn ó padà ó tó dèrò ẹ̀wọ̀n ó lè ṣe ẹlẹ́ṣe kó gbàbẹ̀ kú pé òrónú owó ni ó lówó lọ́wọ́ òrónú owó kó nídìí owó wà rí wá nǹkan yẹn yóò kó lè gbé kó lára ó wà sí ẹlẹ́ṣe owó tó wà rí náà àwọn aládùúgbò rẹ̀ àtàwọn olólùfẹ́ rẹ̀ wọ́n mọ̀ fi ìnira àtẹkún ìbànújẹ́ mọ̀ fi wú mọ̀ náà lórí ẹni kò dáa bẹ́ẹ̀ ẹjọ́ mo pè wá mo rọ̀ yín ẹ má jẹ́ á ṣe oògùn lò tí nǹkan bá ń ṣe wá ẹ jẹ́ ká tó dá àwọn akọ́ṣẹ́mọṣẹ́ wọ́n ṣègùn òyìnbó wọ́n ó sọ fún wa oògùn tá a nílò ẹ̀wò tá a ṣe ká tó lè lo oògùn tá a lò àárọ̀ ni ọ̀sán ni alẹ́ ni ẹ̀ẹ̀kan lójúmọ́ ni ẹ̀ẹ̀márùn ni ó ní oògùn tá a lò ṣùgbọ́n wọ́n tí ò béèrè lọ́wọ́ akọ́ṣẹ́mọṣẹ́ tó kàn pọ̀ bí oògùn tó ń lò lòkulò tó bá délé tán kò ní wọ́n ní wọ́n nìkan mọ́ ó kò bá ara rẹ̀ ó kó bá ẹbí rẹ, ó kó bá alábàgbélé rẹ, ó kó bá aládùúgbò rẹ, ó kó bá àwùjọ rẹ, ó kó bá ilé ìwòsàn tó bá lọ. Torí pé kí ni, ó dá gbogbo wọn sí rìbòrìbò nítorí òní lálàáfíà. Mo fọlọ́run bẹ̀ yín, ẹ má jẹ́ ká ṣi ògùn lò fún ara ẹni, fún tèmi kọ́, tí má ní kó o ṣògùn lò, kó o ṣàárẹ̀, wọ́n sọ ọsibítù, kó o náwó, ìdààmú tó fún ọsibítù àti àwùjọ rẹ, ohun gangan kọ́. So jọ mo fi ọmọ bí ọmọ rẹ̀, má ṣi ògùn lò mọ́. Tó bá ti ń lò tẹ́tẹ̀lẹ̀, lọ rí àwọn akọ́ṣẹ́mọṣẹ́ kí wọ́n tọ́jú rẹ, kó kúrò lára rẹ, kó má lò mọ́. Tó bá délẹ̀ tán, agbára rẹ̀ nìkan mọ́. Tápò dẹ̀ rí pé ó ti mọ́ lára, ó ṣe é ṣe kó lè lò mọ́. Àyè sí wà, àyè sí pọ̀ fún ẹ tí wọ́n tọ́jú tẹ́ kó lè lò ó dẹ̀ ó lálàáfíà tó lè níṣòro kankan ní agbára rẹ mọ́. Tó jọ mo bí ọ, mo rọ̀ ọ́, má ṣi ògùn lò mọ́. Ògùn tí àwọn akọ́ṣẹ́mọṣẹ́ bá kọ fún ẹni kó máa lò, tí má lè lò kan láàárọ̀, ìkan lálẹ́, má lò méjì láàárọ̀, méjì lọ́sàn, méjì lálẹ́, má lò méjì. Tó bá lo ògùn tí ò bá ṣiṣẹ́ lára rẹ, ọ̀tún bá ṣe bákan lára rẹ, sọ fún akọ́ṣẹ́mọṣẹ́ pé ògùn tẹ́ ẹ fún mi o, báyìí ló ṣe ń ṣe o, wọ́n ó bọ̀ wá àtúnṣe sí i. So fún díẹ̀ yìí, ẹ má jẹ́ á ṣi ògùn lò. Ọlọ́run wà pẹ̀lú wa, ọ̀yọ́ wo ní bàjẹ́. Mo máa ń sọ fún gbogbo wa, ìlera rẹ tó péye ọwọ́ ẹ ló wà, má fọwọ́ yẹpẹrẹ mú. Ọlọ́run jẹ́ á rí wàhálà fún ẹbí wa àtara wa, má fọwọ́ yẹpẹrẹ mú ìlera rẹ. Kí n tó máa lọ ní àkókò yìí, ẹ má gbàgbé láti subscribe sórí YouTube wa. Ẹ subscribe, kẹ́ like, kẹ́ dẹ̀ comment, kẹ́ sọ bí fídíò ṣe rí, bóyá a ṣe dáadáa, àbòkú díẹ̀ káàtó, àbí ká fi kún ọ̀káyọ kúrò, ìkan àbí méjì, kí Ọlọ́run kó ràn wá lọ́wọ́. Ẹ ṣé gan, ó dàbọ̀, ó dìgbà kan náà.